In osteology today, we will be looking at the skull in the lateral view, and that is the norma lateralis. So as with any norma, we first define what are the bones that we can see in the norma lateralis. They are the frontal bone, the parietal, the squamous part of the occipital bone, the temporal bone. In the temporal bone, we have the squamous part, the mastoid part, and we can also see that the zygomatic process, the styloid process, and this part called the tympanic plate is included when we say temporal bone. We can also see the greater wing of the sphenoid, and it is actually the external surface of the greater wing of the sphenoid bone. The other bones that we can see are the zygomatic, the maxilla, the nasal bones, and the mandible, and we can actually make out a small part of the lacrimal bones also. So what are the chief features that we see in this norma? The first one that we can note is this head-shaped suture here, which is called the pterion. It is the meeting point of four bones, the frontal, the parietal, the sphenoid, and the temporal. And this point, or the pterion, is significant because deep to this lies the anterior branch of the middle meningeal artery, which is often vulnerable to hemorrhage from trauma and road traffic accidents and so on. And this is deep to this also lies one part of the cerebrum, which is the stem of the lateral sulcus. The next feature we can note is this zygomatic arch here, and as you can see, it is made up of two bones. This is the temporal process of the zygomatic bone, and this is the zygomatic process of the temporal bone. They meet here at this suture, which is called the zygomatico-temporal suture. The zygomatic process of the temporal bone is attached to the squamous part of the temporal bone through this part here, which is called the root of the zygoma. So we have an anterior root, this is the anterior root, and this is the posterior root. Now on the inferior border of the posterior root, we can make out two elevations. And this is called the articular tubercle, whereas the elevation which is posterior to the condylar fossa or the glenoid fossa, this, the mandibular fossa, this elevation is called the postglenoid tubercle. There are two faint curved lines which can be seen on norma lateralis beginning from here. This is the superior temporal line, which becomes very faint posteriorly, and then beneath it or below it we have the inferior temporal line, which can actually be traced back and becomes continuous with this elevated portion here on the temporal bone, which is called the supramastoid crest. It's called the supramastoid crest, and then continues to be with the posterior root of the zygoma. The boundaries of the temporal fossa, the infratemporal fossa, and the pterygopalatine fossa have already been discussed in another class. Let us now look at the external acoustic meatus. The external acoustic meatus is formed anteriorly, inferiorly, and the inferior part of the posterior part. This is formed by the tympanic plate. The postero-superior part of the opening of the external acoustic meatus, it is bounded by the squamous part of the temporal bone. This part where the tympanic plate meets the mastoid process is called the tympanomastoid fissure, and this is the mastoid process which develops around 2 years of age, Let us take a look at the styloid process. So as you can see, this is a sharp bony projection. It projects anteriorly, inferiorly, and a little bit medially. And the apex or the tip of the styloid process is hidden by the ramus of the mandible. The meeting point of these sutures, the lambdoid, the parietomastoid, and the occipitomastoid, this point is called the asterion, and it is the site of the posterolateral fontanelle. Here, this is the supramastoid crest. Anteriorly, the posterior and superior border of the external acoustic meatus, and an imaginary tangential line drawn to the posterior border. This circumscribes a triangular area which is called the suprameatal triangle or the Massillon's triangle. It is the lateral wall of the mastoid antrum, and hence it is the site of surgical access to surgeries on the mastoid antrum.